Hello, Mr. George. I am Sarah. This is Iris. We are your nurses.
Hello.
I want to teach you a little bit about heart failure since you have been diagnosed with this. Heart failure is a progressive disease when your heart is not pumping efficiently enough to supply blood to the body. In your case, you have left-sided heart failure. So fluid is building up in your lungs. This is why you were having trouble breathing and you were feeling fatigue. There were also other symptoms you may or may not have noticed. For example, you were having some fluid buildup in your lungs, and when I listened to your breathing with a stethoscope, I could hear the fluid. I also noticed that you had weak pulses in your extremities. This is because you were having poor circulation. You also have atrial fibrillation, also called AFib. Maybe you have heard that term before. It means that you have an abnormal heart rhythm. The pacemaker cells in your heart are firing against one another and it is causing the heart to quiver.
Is this why sometimes I feel like my heart is beating really fast?
Yes, Mr. George, this is a likely explanation.
I would like to go over your medications with you. We will be sending you home with a new medication. The doctor would like you to start using lisinopril. It is going to help control your blood pressure and help your heart so that it does not have to work as hard as it has been. There are other benefits to taking this medication as well. For example, it reduces the chances of you having a heart attack or stroke. It is important for you to limit your salt intake while taking this medication. You will need to take your medication every day, ideally at the same time every day. If you begin to feel lightheaded, try to lay down and see if you feel better. One of the side effects of this medication is a cough. If it starts to become a problem for you, make sure to tell your doctor when you see him. You also need to avoid potassium supplements while taking this medication. The VA was able to fill your prescription, and I have it here. There is 30 days worth of medication here. Also make sure if you start to have chest pain or feel shortness of breath that does not go away when you rest, you need to call 911 or get to a hospital right away. Try to be mindful about the way you feel and pay attention to any changes or if you notice something off. Do you have any questions about your medication?
What will it cost me? I do not have money to pay for this medicine.
We were able to advocate for you on this, and because you are a veteran, it will be covered through the VA.
Yes, Iris is making an important point. The Veterans Administration is going to be your agency. It is important for you to follow up with Dr. Cardio, your heart doctor. We have made an appointment for you with him for a week from today. He will be overseeing your care after you leave here. It is likely he will want you to go to cardiac rehab once or twice per week. He has a great team that will be available to you for this program.
You have been here at the hospital for over 7 days now, so you are detoxed from alcohol and drugs. However, for long-term health and success with treatment for heart failure and AFib, you may want to consider some resources we have put together for your mental health. Would you be willing to hear about some options we are able to offer?
Yes, I realize that my health is not good, and I need to think about how to take care of myself better. Please let me know what you have to offer.
If you agree, the social worker can set you up to see the psychiatric nurse practitioner, Dr. Navarro. He works with veterans through the VA and is a great option for you. He would schedule you for a psychiatric evaluation for purposes of medication management and work with a case manager at the VA to help with additional resources. We would like you to have a drug and alcohol screening as well, which would open the door for you to seek rehabilitation services. There may even be inpatient options with step-down into intensive outpatient services for continuation of your recovery. There are also sober living homes where you may be able to live on a long-term basis. I know that this is a lot of information, but there is a team of people available as resources for you. How do you feel about these options and your continued sobriety?
Wow, there are a lot of resources available to help me. I did not know that all this was available. I am so grateful for the opportunity. Thank you so much for taking the time to help me.
The social worker that came to speak with you yesterday was able to get you enrolled in veterans benefits, so all the options we are telling you about are completely covered. but it is up to you to take advantage of them. We were also able to get you a bus pass that should take you en route to the Salvation Army. It is early enough in the morning that you most likely can get a bed and you can stay there for a few days to rest. How does this sound to you?
It sounds good. You both have been very helpful in putting this all together for me.
We worked as a team with your health in mind. It was our pleasure to help. Thank you for allowing us to work with you.
I hope that you take the help that we have talked about and wish you the very best in life.
Thank you. Although it's a lot to take in right now, I intend on doing my best to follow through on going my new doctors and getting into a drug and alcohol treatment program.
All this information is written here in the discharge paperwork, and if you think of any questions, there is a phone number for you to call.
Thank you again.
Bye.
Goodbye.